Hi, this is Paul Barr, Senior Editor with Hospitals and Health Networks magazine. I'm here today with Suzanna Hoppszallern, Senior Editor and point person for the Most Wired program. Thanks for being with us here today, Suzanna.
Thank you, Paul.
Well, the results are coming out today, and I would want to know what are some of the major themes coming out of the Most Wired data?
One of the most significant developments that we've seen this year is how hospitals are using technology to engage with patients, to connect on an ongoing basis through all kinds of devices, whether it's their phone, through telemedicine, remote monitoring. So about 3/4 are now actually offering secure messaging with clinicians on a regular basis, as well as home monitoring with the care team. The other area where we've seen a big investment is in cybersecurity. And hospitals are very concerned as they're opening up the communication exchange with patients to make sure that they have a very secure platform. They are investing in all of the technologies to help prevent attacks and to monitor ongoing security breaches. But they are also really spending the time with staff to make sure that they understand and they engage in surprise phishing exercises with regularity to make sure that staff are up to date on the organizational protocols. Then the third area where we've seen a big jump is in the use of analytics. 3/4 of the organizations can use predictive analytics and business intelligence in some capacity to make operational improvements. So we see a lot of the quality improvement now being driven by data. But the other part of it is that we still have a lot of tools that need to be developed for value-based care. And we found that only 1/3 of the organizations can actually track a patient and monitor with a value-based condition such as chronic obstructive pulmonary disease. So while we're making big advances in this area to really get down to the patient level where it's going to produce that value, it's still going to take more time and effort.
Are there any other examples of Most Wired activities that hospitals or health systems are doing?
We saw a big jump this year in hospitals really breaking out of the traditional walls of the hospital. So you see more than 60% actually incorporating data from patients. They're able to do that now, and they want to keep an ongoing dialogue with the patient, so it's a two-way communication. We also have a lot of gaps in behavioral health services, so about half of the hospitals are now offering behavioral health services through telemedicine to really provide more access to patients in this very important area. We also have a big increase in virtual physician visits. This is now up to 40% among the Most Wired organizations. So you can see the communication is very robust, using all the electronic tools and really making it not just we're seeing you once in a while, but we're working with you on your health on an ongoing basis.
And where are Most Wired hospitals and health systems investing their resources right now?
We have seen a big investment in infrastructure. This year, one of the new requirements was to make sure that if there was a disaster, not only could you restore your clinical data in a timely fashion, but also supply chain information, financial information, and staffing information, the HR functions.
Thanks for talking with us today, Suzanna.
Thank you, Paul.
For more information on the Most Wired program, including data, stories, and profiles, go to www.hhnmag.com/mostwired. For H&HN, this is Paul Barr.